Hello everyone, I am Rubina Saeed with my channel Wise and Very. Today's topic is the fecal transplantation therapy for digestive disorders. Please read the disclaimer. So, what is the need of fecal microbiota transplantation therapy? As you can recall from the seminar series, the role uh, gut microbiota play in the health of lung, central nervous system, and immune system in general, and in the growth. If you do not have good gut microbiota, meaning you never really acquired it through your childhood, and or you have destroyed it through eating the junk food, you would have um, health problems later on. So gut, it's been shown that the gut crosstalks, that's where the two way arrow is, crosstalk with the lung bacteria, and through the immune cells or through messenger molecules, and there are bacteria in the lungs. So there is a gut, lung, or airway axis. There is gut central nervous system axis, and there is gut immune system axis, and the gut microbiome talks to all these, keeping it healthy. If you have good food, meaning when it Mediterranean kind of diet where you have high fiber and low fat, high fiber actually is very good because short chain fatty acid here is a metabolite that comes out from the fiber. So fiber, when humans do not have the enzyme to digest to digest fiber. If we do not have good bacteria and we eat fiber, it pretty much comes out intact. We do not have enzyme to digest it. So gut bacteria has the enzyme that ferment the fiber and produce short chain fatty acid, which is play a major role in crosstalk of these all three of these. If you don't have beneficial bacteria, you how do you acquire it? So that's where the fecal microbiome transplantation therapy is. So now when you have a good picture of how the gut microbiota plays a role in your health, having a good microbiota is extremely crucial. So if you have destroyed your gut microbiota through the Western diet or junk food, or you never have really acquired it when you were growing up, and um, so, in both the cases, it's good to go for the therapy. Ask your physician. If you're suffering from digestive disorder like colitis or Crohn's disease, this therapy proven to be very good for colitis, which is caused by Clostridium um, uh, difficile, and it's an antibiotic resistant bacteria. So this has shown promising benefits against colitis. The other form is the other digestive disorder maybe it is good for is Crohn's disease, which is in Crohn's disease the whole gastrointestinal system has inflammation. And if you're wondering what's the difference between this therapy and taking probiotics, probiotics is just a cocktail of a few bacteria. If you remember from the seminar series, in one of the slides I was showing you that the gut microbiota has more than 1,000 species. So this have the good bacteria from that it has more variety of beneficial bacteria. So it's more resembling what your gut should have. So if you so what is the fecal sample? The fecal sample is actually the feces taken from a healthy individual and purifying it to an extent that it would be remains with only with bacteria. Once you have this bacteria, concentrated bacteria, you encapsulate, you purify it, and then you encapsulate it in pills, three gel layers capsule, you or liquid form, and there are many ways, mode of entry. So one of the way, you take the capsule by mouth, or you take through the nasogastric tube, or you can someone can administer this gastroenterologist through colonoscopy. It has proven to have very high success rate. As you can see here, fecal microbiota transplantation has cure rates ranging between 85 to 95%. I have done some research on it, and it was always consistently showing the significant effect on good effect on mouse model of Crohn's disease. They so if you are suffering of any of those, ask your physician if you can have this therapy. So this therapy may be good for in general for digestive disorders like colitis and Crohn's, as I mentioned before, and maybe in general for constipation. It may also be good for allergies because of the gut airway axis crosstalk. It may be good for central nervous system diseases or disorders where dysbiosis or imbalance in the gut play a role in the pathogenesis of disease, and maybe and for sure it would be beneficial for immune system, overall immune system health. That's where I end this video. Thank you very much for listening. Bye bye.